Hey there, and welcome back to PCOS Unfiltered, where we ditch the fads and get real about healing with PCOS. I'm your host, Lindsie, and today's episode is extra special because I'm joined by Dr. Anya Szigeti, a chiropractic internist specializing in functional medicine and nutrition. We're diving into the role of gut health on hormones and PCOS. You're going to walk away with real-world insights, a few laughs, and lots of empowerment. So let's jump in. So, how does functional medicine differ in the way it views healing compared to conventional quick fixes? Another good question.
So we look at functional medicine in the realm that I'm in, holistic functional medicine. We really focus on the cause or the trigger and not on so much on like suppressing a symptom. So we're looking at something that's personalized, specific to the patient and their health scenario, but also in a way that's going to empower them. So asking like, why is this happening versus how can we mute or mask the symptom?
Mhm.
And then once we identify certain imbalance, I personally will recommend things like food as medicine. So we're focusing on foods that nourish and heal and set aside foods that, maybe don't serve us during this phase of life. I also look at incorporating supplements and herbs to help to bring the body into balance. So it's typically either we have an excess, like dysbiosis in the gut, for example, or a deficiency from like a certain nutrient, like magnesium is a big one, or vitamin D, for example. And so then we will add those in and then look at different lifestyle modifications that have huge impacts on our overall health, like the proper mindset and, trying to be really mindful and movement and sleep and stress management. And so we look at all those different pieces of the puzzle, obviously look at what the patient's doing currently, and then what do we need to focus on for their specific phase of life. But it's an empowering process because my goal as a holistic functional medicine is to guide you, to educate you, to equip you, empower you so that you can make the best decisions for your health moving forward. I love all of my patients, but I don't want them to need me forever. And so that's a huge difference from allopathic medicine or the conventional medicine business model. 'Cause I'm here to help guide you along your journey and transform your health and empower you and then set you free.
Yeah. Yeah, that's definitely a huge one. Again, I see like a lot of people that just you get into kind of the healthcare system
Yes.
and you're stuck there and you think you need them. And yeah, and then like you said about using foods to heal. I mean, that was a big wake-up call for me that I could actually eat to heal my body and not, yes, I was eating and it was hurting my body for years, but like, wow, I could actually eat better foods and heal, help heal my body in that way too. That was a big
Mhm.
one. So stress, we often talk about cortisol and stress and PCOS. You've already talked a little bit about the stressor, piece, but can you explain the gut brain connection and how chronic stress affects both gut health and hormone regulation?
Yeah. So chronic stress, when we're kind of looking at that, we're looking at not only stressors that we consciously perceive, but whatever our body subconsciously perceives. So that's where it ties in a lot of the trauma piece of the puzzle. Because if we go through situations in life, things can trigger those past traumas that we don't even consciously know, which is a little bit mind blowing if you think about it. But so all of that is happening. So our brains are processing all of these things. Obviously the chronic stressors like getting cut off in traffic or getting it, chased by a dog or something like that. Your body's going to go into that stress mode. But it's also could have, if someone says something and triggers an old emotional traumatic event, that can be a stress as well. And so what that's doing is it's triggering the HPA axis, so the wow, I can't talk. The hypopituitary adrenal axis. That's a mouthful.
It is a mouthful.
And so that's going to increase cortisol. So now cortisol often gets a bad rap because everyone's like, oh, it's the stress hormone, blah, 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 blah. Well, yes, but it's also necessary for life. This is the hormone that allows the moms to pick the cars up off the babies. Like, we need cortisol for sure. Like, we will die without it. But the problem is most of us are stuck in this sympathetic overdrive, sympathetic nervous system from all these chronic stress and triggers, where our bodies are like constantly in this fight or flight mode. We're pumping out so much cortisol that it's inhibiting the parasympathetic, which is the rest, digest, regenerate, heal, procreate. That
Hmm.
nervous system is being
Yeah.
inhibited because they both can't operate at the same time.
Yeah.
So when we're stuck in that sympathetic overdrive, that can cause like bloating and can trigger leaky gut, inflammation. It's going to disrupt our body's ability to be sensitive to insulin and properly produce our hormones. And it's like this vicious cycle that we get stuck in, the sympathetic nervous system overdrive. And then our bodies aren't able to regenerate, to heal, to reproduce, to rest.
Yeah. Yeah. Makes a lot of sense. Um, I mean, I feel like we kind of, let me ask you this, but I feel like we kind of answered, but how do things like, trauma that you mentioned already, the burnout, the nervous system dysregulation disrupt gut function and in turn worsen PCOS?
Mhm. So if we think about something like the unresolved traumas that I mentioned about, or adverse childhood experiences, and then our bodies are kind of burnt out in that stressed system, we're stuck in that fight or flight mode. And so if you, everything is shifted away. So even blood flow is shifted away from the digestive system, reproductive systems. The gut becomes inflamed. The cortisol elevations are going to hijack all of our hormone balances. And so when we are evaluating the whole person and the whole all the pieces, we need to look at things like
Hmm.
past traumas, the stress resiliency, the nervous system balance or imbalance, because they are going to for sure all negatively affect gut function and hormone imbalance and worsen things like PCOS as well, and Hashimoto's thyroiditis too. Yeah.
Yeah. And yeah, and sometimes those can all go hand in hand. I feel like that's probably why you see like autoimmune conditions paired with PCOS or, a couple autoimmune conditions, together. And I know I remember hearing it back in the day that, yeah, like, you usually don't just have one autoimmune condition, you usually have a couple. Um, so,
Unfortunately,
um,
once you have one, they say it kind of opens the door for others.
yeah,
And the
yeah.
way I look at it is that the majority of autoimmune conditions or anything with like a syndrome is they have a lot of foundational similarities,
Hmm.
unfortunately. Imbalances, foundational imbalances that are similar. And so if you have systemic inflammation and you have, you've had poor stress resilience and you have leaky gut and dysbiosis and poor nutrition choices, all of those can lead to, triggering certain types of autoimmune conditions, but also PCOS and different types of syndromes too, because a lot of those foundational pieces, those foundational balances are similar across the board. And
Yeah.
then it's almost like it's going to find the weak link for you and head there.
And manifests. Yeah.
And then it's a domino effect because
Yeah.
unfortunately, with allopathic conventional medicine, is looking at the symptom. So they're addressing the symptom. They're not looking at typically the foundational imbalances. And so then you're just continuing that door's open and just
Hmm.
continuing down the path of other imbalances and diagnoses and different things.
Yeah. Yeah. So what are some practical first steps to begin healing the gut, especially for women and women with PCOS?
So I love to do this with diet. So, and not saying diet as in like mindset or lifestyle whatsoever,
Hmm.
but looking at foods that are going to calm inflammation and help to repair and rebuild and rebalance. And so, looking at anti inflammatory foods, looking at foods that will balance out the blood sugar and stabilize the blood sugar. So, we're looking at whole actual foods, like single ingredient foods, looking at plant-based fibers, lots of different colors, wide variety, eating the rainbow, for example, looking at healthy fats. And some of my favorite healthy fats that help with balancing hormones and healing the gut are things like avocados, avocado oil, coconut oil, olives, olive oil. And then we're looking at high quality protein. So you want to make sure that you're getting, if you're consuming meat products, for example, animal products, that you're getting grass fed red meats and organ meats. I know organ meats are tough for some people. I'm working on a couple recipes that incorporate some different organ meats because they just are so nutrient rich that I want to try to bring those to America. I'm actually in Europe right now, and eating organ meat is much more prevalent here. And so I'm practicing with some recipes that I can bring back to my USA people. Um, and then if you're eating poultry and eggs, making sure you're selecting organic. And then if you're consuming seafood, selecting wild caught. And then if you're doing plant-based protein, you just be mindful that we typically need to consume a higher amount of plant-based protein just because we're not absorbing as much. But you want to make sure you're selecting organic from those. And then things that typically aren't serving us in this phase of healing are things like gluten, dairy, and processed sugar are probably the three biggest ones that I would say, let's hold off on those for this phase of life, and work on focusing on the things that are going to heal and nourish your body versus the things that can irritate and cause further imbalance.
Yeah. Yeah. One thing, like during my 90-day program and my mindful eating challenge that I have, is we talk about how we as a society are overfed and undernourished. And so, yeah, so even if you just start adding in some of those nutrient dense foods without even removing anything, because
Mhm.
that's where the mind starts playing tricks on you, of course.
Yeah.
But yeah, even just by starting to add in some of those things, you can start healing. And then because as you've talked about, your body is very, very smart. It's going to start saying, you know what? I don't need all that other stuff anymore because you're giving me all these nutrients that I do need with these foods. So you know what? Those other foods don't taste very good anymore. So yeah, yeah, that's a huge one. And how does nutrition differ with the functional medicine side versus, traditional medicine, diet culture, all that stuff?
Yeah.
Mhm.
So functional medicine is about abundance and healing and nourishment and not restriction. And, the way that I work, I personalize it to the individual's biology. So it's not just like a one size fits all, but it's about supporting optimal function, hormone balancing versus chasing a number on a scale or, a visual image of what you want to look like, because that traditional diet culture is very triggering. It's restrictive. It is unattainable, unachievable. And I think, again, we can all raise our hand and say we're guilty of trying all these crazy diets and things because we were told that they would help us and make us feel better. And, whatever false promise we were fed to do all these things that actually cause way more damage, not just to the scale, but they can tank your hormones like crazy. They can damage your gut. They stress your thyroid out and stress your adrenal glands out. And they can cause and be actual one of the root causes of issues later on down the road as well. So I think that we could add that to the list of things that a lot of us did in our 20s and 30s
Yes.
that set us up for
Yes.
failure.
Yes. Yeah, it's like when did eating get so complicated? It shouldn't
Oh,
yeah, it shouldn't be that complicated. And then if you are the one that's eating like we're supposed to eat, like our
mhm.
ancestors ate back in the day, like you're not the normal one. You're the one that, like then they think you are on a diet.
Oh yeah,
So it's
trust
it's
me.
a
I get my
yeah.
skin examined anywhere we go with
Oh
friends.
yeah.
I get
Same.
like invested, like, what's this? What's that? Like, why are you eating this? Why are you eating that? Like, why aren't you? Oh, okay, it's fine. This is just like, this is what helps my body to stay nourished and balanced, and I feel the best. And,
Exactly. Yeah.
yeah.
And then the point you made about, chasing a number on a scale, I mean, yeah, that's huge too. Whether it's a weight loss journey or a health journey, you have to really go by how you feel and all those other small little things that add up. those small wins and stuff instead of just that number. That number is like the tiniest little piece.
It's good to have some information.
Yes.
And
Yeah.
so, yes, okay. There are areas we definitely know, okay, if you're at this certain number, then, we definitely need to
Mhm.
make some drastic changes. But I think we can tell that without stepping
Exactly. Yeah.
up.
And especially stepping on the scale every day because, like you said, these things don't happen overnight. So there's no way that overnight that number on the scale is going to change that much. And
Yes.
then you also think then at that point, well, I'm doing all this stuff and it's not working. So yeah, like,
Beat yourself up and then it becomes,
yes.
oh, yep, yep.
Yep.
And then
Increase your
there's ways
cortisol.
yes, exactly. And then we're just spiraling over.
Yeah.
But then it's not
Yeah.
looking at the composition either, and I'm sure you touch on this a good bit as well.
Hmm.
But women, we want muscle. We need muscle, and muscle weighs more than fat.
Yeah.
Like I'd
Yeah.
rather be, 10 pounds heavier than I'm supposed to be and have muscle than
Hmm.
be an ideal number on the scale and be fat, like have fat content and no muscle.
Yeah. Yeah. Yeah, for sure. So are there any specific foods or habits that you recommend to support gut health and hormone balance?
Yes. Some of my favorites are bone broth. Love bone broth, especially homemade bone broth. Um, Leafy greens, cruciferous vegetables. One of my favorites for hormone balancing is broccoli sprouts. It's very detoxifying for estrogen specifically. And that is something that I very often will grow myself, get like a little sprouting jar and make my own broccoli sprouts and just add them to literally everything on top of salads, on top of meats, on top of eggs, whatever you're having. I have often throw them into a smoothie as well and just blend them up. So that way there's zero excuses to incorporate broccoli sprouts into soups, everything. Um, and then some of the like the high quality proteins that I kind of mentioned before and the healthy fats as well. But there's a few lifestyle habits that I want to recommend too. So making sure that you're chewing your food, which is like mind blowing to me that I didn't do this. And I was like crazy rushed when I was eating, especially in the military and corporate America. But sitting down and actually chewing your food and being mindful. I go through this entire series called Love Your Guts, all about digestive wellness and optimization. And one of the key pieces is like actually physically making your own food, and that triggers all of your digestive juices to start the process, and then physically chewing your food so it's the consistency of baby food before you swallow it, because that's the majority of the mechanical digestion is in the mouth. And then if you're swallowing bigger chunks of food, especially like proteins or like very fibrous foods, your body's not going to be able to break that down. So then it's going to stress your digestive system trying, attempting to break that down, and then you're not going to absorb the nutrients from it. And so
Yeah.
that's a big piece of it. So eating mindfully, avoiding late night meals. So there's a lot of talk about fasting and intermittent fasting and all these different things, but we were kind of made to have our last meal kind of around sundown, which throws me out of the loop here because the sun sets at like 8:30 here. It's like still light out. I'm like, what's happening? And then the sunrise is at like 5 something, and I'm like, what is going on?
Hmm.
So that throws me for a loop here. But in Florida, when the sun is setting, like that's when we should be having, finishing up our last meal and then not eating again for 12 to 14 hours. And so I think, again, raise my hand myself, I definitely did this. Late night eating is usually not the healthiest choices. It's usually something sweet, something salty, or something alcoholic that, we definitely don't need to be having any of those before we go to bed, because then we're overloading our digestive system again. We could be imbalancing our hormones again. So those are a couple key pieces. Making sure that we're moving our body and our bowels every day. I do like to talk about poop. It's very important to make sure we're moving those.
Yep.
Um, and then practicing mindfulness, however that resonates for you individually, focusing on quality sleep and getting sunlight, not only in the morning, but actually in the afternoons as well. And so actually one of the things that I've started doing is not wearing my sunglasses. like almost ever anymore, because the sunlight helps to set our circadian rhythms, which is often thought of as our sleep-wake rhythms, is another way to look at it. And that's helping to balance out our cortisol, helping to balance out our melatonin, getting our quality sleep, getting us into the parasympathetic rest and digest nervous system. And so it's helping with basically everything we've talked about today.
Yeah, I actually read something about that not too long ago about the sunglasses and and removing them. Yeah. So it's very interesting. Um, so can you share a client story where gut healing significantly improved their symptoms, maybe specific PCOS symptoms?
Yep. So I had a patient that had really severe, like cystic acne, very irregular periods, and like a lot of fatigue. And so we did a stool test on her, and it showed Candida overgrowth, which is a common fungus, but when it's overgrown, that is signifying to me that the immune system is not resilient. It is
Mhm.
worn down, because a normal immune system, a healthy immune system, can handle and balance out Candida. And then she had pretty significant dysbiosis. So this is a imbalance in the microbes, the healthy microbes within her gut. The food sensitivity test showed that she was sensitive to about a dozen healthy foods. So just a little bit of information on food sensitivity, because there's a lot of different levels, and of course with everything a lot of misinformation, but typically with an allergy to a food, you're going to know, because you're going to have a response to that food pretty quickly. And so one way to think about that is like an anaphylactic reaction, with your throat closing with someone that has a peanut allergy, for example. So I don't typically test for allergies. I test for sensitivities, because a sensitivity can take up to 72 hours, so 3 days before a symptom shows up. And the symptom can be very vague, like fatigue or joint pain. It can be very specific, like a gut specific symptom, like diarrhea or constipation or bloating. But when it's 3 days later, it's really hard to tell. Was it that banana that I had for breakfast,
Mhm.
or the broccoli I had for dinner, or the blueberries I had for dessert? What caused it? So that's why I really love um, sensitivity testing. And the food sensitivity test that I use also has that gut barrier panel in it. So I'm able to see how damaged is the gut lining, and how much work do we need to do to really start to rebuild. So we were able to figure out things like bananas, broccoli, and blueberries were actually causing her sensitivities and causing her issues. So we pulled them, because they weren't serving her on this journey right now.
Mhm.
So luckily, she was very compliant. And we worked together pretty and I don't want to say aggressively, because that's kind of a scary term, but she was very dedicated for 3 months. And we did the target nutrients and gut protocols, and then her skin started to clear up, and her period started to balance, and she started to have more energy. So it's like it I don't want to paint it as like, oh, it was that easy, but in a sense it can be once we get
Mhm.
identify the foundational imbalances and work to resolve that. And I have lovely, very compliant patients that follow the recommendations, because it's your body, your choice. At the end of the day, I'm the guide. I will, interpret the tests for you and translate them, and so you can understand, but you're the one doing the things. Like, I'm not sitting there with you at every meal and every time that you're eating something saying, don't have that. I don't think that's
Mhm.
good for you. Like, that's not how it works. Like, it's your body, your choice. This is what's serving you. This is what's not serving you. And we go from there and work together.
Yeah. Yeah. So I actually do have a food timeline tool that is in the notes that you can go in and check out. But it basically, without getting the testing, even before you get the test, I wish I would have done that myself.
Mhm.
Something like that. I did eventually get the testing, but you can start tracking some of this stuff, even, if you take like 3 days, because like you just said, okay, how am I feeling when I eat the food? How am I feeling during? How am I feeling right after? And then, yeah, long after. And whether that's, a couple hours later, the next morning, 3 days later, you can start putting some pieces together and start like realizing, okay, I had that. Now I feel like this. I had it again. I feel worse, and you can start doing some of these things. Yeah, even without the full testing. Um,
Too on that same thought process, because that's a similar tool that I use for my patients as well, is
mhm,
just a simple food log.
yeah.
Everybody hates doing it, and trust me, I hated doing it too, but it is so clarifying.
Hmm. Big
One,
time.
to physically see what you're consuming and look back on it, but also the accountability of, I'm eating this piece of chocolate and then I have to write it down and send this to somebody else.
Hmm.
It's
Yeah.
it's kind of like a, oh, wait a minute.
Yeah.
Am I
Yeah.
really gonna do this?
Yeah. Yeah. I mean, and if you're prioritizing your health, like I usually say like 3 days. I
Mhm.
think you do the same, right?
I'd say
Yeah,
a minimum of 3 days. Some people I
yeah.
go up to seven, but a minimum of three.
That's what I was gonna say. 7 would be optimal.
Are eating the same stuff over and over and over again too. So that's another,
Yes.
I mean,
Yeah.
we have a divergent
Yeah.
topic we can go
Yeah.
on.
That's why I usually try to say like at least like one weekend day and then like a couple other, weekdays. Yeah, because I feel like a lot of the times Monday through Friday we're probably eating a lot of the same stuff. So even if you can include like at least one weekend day on there, that
Mhm.
can kind of help. Your routine's probably not normal, depending on what kind of schedule you work, but then yeah, then that can help too. Wow, what an amazing conversation. Big thanks to Dr. Anya for sharing her time, her wisdom, and her heart with us today. I hope you're feeling as inspired and empowered as I am. If you'd like to connect with Dr. Anya, you can find all the info in the show notes. And if you love today's episode, don't forget to subscribe, share it with a friend who needs to hear it, and leave a quick review. It helps us reach even more amazing women just like you. Until next time, keep nourishing your body, healing your heart, and thriving, unfiltered and unstoppable.